26th webinar of Nepal Mental Health Research webinar series. I am Vinita Acharya, Research Officer at TPO Nepal. So today I will be moderating this webinar session on behalf of our team. If you are joining for the first time, these webinar series are being conducted by TPO Nepal in close coordination with George Washington University. So basically focusing in the capacity building of early and mid-career mental and behavioral health researchers. Today we also have Ritika Singh as usual, who will be handling the technical aspect of the webinar as well as co-moderating the breakout sessions, which we will have after the presentations as well. So as you can see in the screen, the title of our 26th webinar series, which is the integration of artificial intelligence in mental health research, and our speaker is Dr. Alistair Van Heijden. We have Dr. Brandon Court, who is professor at George Washington University. He will be introducing our speaker later. Before that, we have some couple of reminders that we share in our each webinar. First thing first, we do record our webinar. So basically, we do record the webinar to save it later and send it to the registered participants so that you can see it later and have information about it and get back to us if you have any queries or suggestions. To remind you, we do send the webinar materials, the slides, and the recordings to the registered participants. So if you haven't registered the webinar yet, please do register the webinar. The next reminder is related to the webinar structure. So basically, the duration of this webinar is an hour from 6 to 7 Nepal time. Which consists of three main parts. After the introduction sessions, our speaker will be presenting his slides for 15 minutes. After that, we will be having the 10 to 15 minutes of Q&A sessions where you can ask your queries or any confusions you have related to the slides, related to the topic, to the speaker. You can raise your hand using the Zoom app, or you can directly write your questions in the message box as well in the question and answer session. So in between the time where our speaker will be presenting his slide, we do not interrupt him in between that presentation. So after the Q&A sessions and discussion sessions, we'll be moving towards the breakout session. The breakout sessions are formed so that the participants are divided into the different groups, which would be easier for us to discuss in a smaller group. In that breakout sessions, we'll be discussing on the discussion questions, which is provided by our speaker, and I will be co-moderating our breakout sessions. Ritika ma'am will co-moderating, and our speaker will be co-moderating the breakout session. We will discuss, and then we will summarize that discussions with all of us after we come back to the main room. Then after that, we will wrap up the webinar. The last reminder is related to the feedback form, which is also crucial for the upcoming plans and structures. So if you have any kind of suggestions related to the topic or related to the structures, you can write it down in the feedback form. So we appreciate your feedback as well. So the topic we are having today is also from the feedback and suggestions from our early and mid-career researchers. So if you have anything to say, you can write it down in the feedback form. So that's all as a reminder. So for the general information, our monthly webinars are being conducted in the third week of every month. Invitation emails will be sent out with the date and speaker details. So also if you have any queries, or if you want to update it to it, so you can follow us in our social media pages as well. So for this introduction of the speaker, I'd like to request Dr. Brandon for the introduction. Thank you.
Great. Thank you so much, Benita. It's absolutely my pleasure to introduce Dr. Alistair Van Heijden. He's a research director of the Center for Community-Based Research at the Human Sciences Research Council and an honorary associate professor in clinical medicine at the University of Witwatersrand at South Africa. And he has over 10 years of experience in conducting clinical, behavioral, and community-based research throughout East and Southern Africa, the United States, Nepal, and Brazil. And he has an interdisciplinary focus to his research, which combines his interest in technology for development and public health with the aim of improving access to care for underserved and poorly researched communities. And just on a personal note, I've been delighted to be able to collaborate with Dr. Van Heerden for almost a decade now. And he's an excellent person to work with, very thought-provoking in terms of his ideas. And I hope all of you will get some new ideas from the conversation today. And I'm sure it will be a stimulating discussion after his presentation. Over to you.
Okay, Al, you can share your screen now. And the floor is yours.
Great. Thank you very much for the introduction. Just checking that you can see my slides, that they're full screen. Great. Well, it's an absolute pleasure to be here. I was very excited when I was invited to come and talk to you all today. Nepal is a place that I'm very fond of and have had the real pleasure of visiting once or twice. And so, yeah, the opportunity to meet with more colleagues in the country really is exciting, as is the topic that you've asked me to talk about. This, to me, feels like one of the, one of the most interesting opportunities that has presented itself in not only to the field of global mental health, but in all aspects of our life that for a long time. And so I think I'm always interested in sharing what I know and just provoking some discussion about how people want to think about and how we as humans want to harness some of these tools, as well as think through some of the risks that may be associated with the coming wave of technology that seems to be speeding up every day. So in brief, this is going to be the three areas of the talk. I will speak a little about the evolution of technologies and how they've got us to the point today where we, I don't know if any of you saw the announcement late last week of Sora, which is the new text-to-video model that OpenAI brought out. And so I want to just discuss how we got there. We'll speak a little bit about the opportunities for mental health, but I think that this is really a space where we could all be thinking, and some of this is also new that I don't think the opportunities are clearly mapped out yet. And so hopefully I'll give some ideas, but there may be a lot more scope for thinking through, particularly for those of you with backgrounds in mental health. And then just ending, I had shared some of these tools with Brandon when I was fortunate enough to see him last week or the week before, and I thought it may be useful for others on this call. If you haven't heard about some of these tools, how AI is enabling researchers also to be able to enhance some of their skills. So let's see if this video plays.
Does it understand what it's doing in the sense that we do? It's easy to leap to false conclusions, as Professor Weizenbaum discovered when he created ELIZA. ELIZA is a computer program that anyone can converse with via the keyboard, and it'll reply on the screen. We've added human speech to make the conversation more clear.
Men are all alike.
In what way?
They're always bugging us about something or other.
Can you think of a specific example?
Well, my boyfriend made me come here.
Your boyfriend made you come here.
He says I'm depressed much of the time.
I'm sorry to hear that you're depressed.
It's true. I am unhappy.
Do you think coming here will help you not to be unhappy?
The computer's replies seem very understanding, but this program is merely triggered by certain phrases to come out with stock responses. Nevertheless, Weizenbaum's secretary fell under the spell of the machine.
Then I asked her to my office and sat her down at the keyboard, and she began to type. And of course, I looked over her shoulder to make sure that everything was operating properly. After 2 or 3 interchanges with the machine, she turned to me and she said, "Would you mind leaving the room, please?"
And yet she knew, as Weizenbaum did, that ELIZA didn't understand a single word that was being typed into it.
So that video is of a program called ELIZA that I learned about in the 90s, not to give away my age, but I became fascinated with the idea that machines could be able to talk back to us, not in vocal terms, but in terms of typing. And that program was developed in the 60s. And so I think, for those of us now living in 2020s and having access to GPT, ChatGPT, etc., this dream has actually been realized. And I mean, I've just really am quite blown away about how quickly and how amazingly humanity has managed to take what was just this very basic program and turn it into something that is actually what that Dr. Weizenbaum had thought up. I wanted to just say and talk a little bit about what makes ELIZA very different to the technology we have today. Because on all appearances, it looks like they had ChatGPT in the 60s. So what makes ELIZA different to the technologies we have today? So the way that program worked was that when you typed, it would look for certain keywords that it would try and match, and it would then produce canned responses. So it would have a database of questions or responses that it could just put on the screen if it found you saying certain words. So if you say, I'm unhappy, it may go and find from its list of responses for being unhappy what it could say back to you. And you can see it's quite compelling in some ways, but very, very limited in others, because if you don't use any of the words that it's trained on, it's not going to be able to respond. In the 2000s, the technology continued to improve, and we got to a place where, rather than keywords, the way that these chatbot systems worked was the extraction of intents and entities, which is similar in some way to keyword matching. But if you said, I want to book a ticket to Nepal, you might be able to, using natural language processing tools, find that where I want to go is Nepal and what I'm wanting to do is a flight. And so you would then also have canned responses to those entities, but it would be a more sophisticated way of discovering what I was asking about. And then, so that was the 2000s, the 2020s have now got us to this place of ChatGPT and other transformer models where you can type basically anything and have a response generated. Maybe just to spend 1 minute on clarifying some of the issues around that technology. The way that the system works is that it is trained on a huge amount of text, both English and other languages, and it learns statistically which is the most likely next word to follow the words that have currently been put into a sentence. So that meant that many people think of it as what they call a stochastic parrot. It just basically parrots back the most likely next word. But what's quite interesting is that for these models to be able to predict the next word, there are a number of researchers that have shown that the model has to build an idea of what the world looks like and how the world works in order to be able to make those next predictions. And so it has emergent properties such as the ability to have a theory of mind, which is I might be able to put myself into your shoes and have a sense of how you might be feeling. And so those sorts of emergent properties go beyond what we currently understand about why just predicting the next word produces some of these other emergent properties. Just to keep you all on the cutting edge, I mean, I think that what comes next and some of the things that we may also want to talk about, because things move so fast, is that we will move from a space of typing text and having text come back, or indeed any of the other modalities, audio, video, etc., to this kind of explanation I have here of some kind of embodiment with the task that produces an action. So just to talk you through each of those, embodiment really means the world in which the AI is working and sort of providing its responses. And so you might ask me, what does that mean? But you could imagine, for example, if you are a game player, that you play a game like Minecraft or World of Warcraft, and those could be environments where the AI could be embodied into that world. And then they obviously, if you think of our world, it's not that helpful having it just in a computer. It might be that we want to think of different forms of physical a physical form for these AIs to embed themselves into. I'll give you some examples in a bit. So embodiment speaks to that world that it works in. We are then now, rather than thinking about text, talking about tasks. So this brings up the idea of agents, where you give an AI agent a task, and it then performs actions on your behalf. So some of you may have seen, for example, there are now tools that allow you to browse the internet. You can say, I want to find all the mental health research that has come out of Nepal, and that's the task. It will then go and open a browser. It will go onto Google Scholar or PubMed, look for papers. It might be able to download those papers. And so we're no longer just talking about text in and out, but this idea of tasks and action. And that is sort of displayed a little bit in this diagram here, a very recent paper that came out a week or two ago, which I think it may be slightly complicated, but I'll just talk you through it as it might give you a sense of what I'm badly trying to explain. If you look on the right-hand side, you will see that there is learning and memory. So the current systems don't have either. If you talk to ChatGPT, it forgets what you've said, and when you come back next week, it will be starting from scratch. And so these new architectures that have been discussed include the idea that you could learn. So if you download my papers and Brandon says, nope, I'm not interested, Al's a terrible researcher, don't look for his papers, it can remember that. And in future engagements, it won't be calling on my papers. So learning and memory, you then have these actions, which are tasks that you may offer. Interesting to mental health researchers like ourselves, the idea of giving these agents empathy, cognitive systems, ways of understanding what it's like to be human, and so that they can engage in more human ways. And finally, the ability to engage with the environment. So that would be, for example, through video. So you might be able to take a photo and have that incorporated into the learning experience. Why this becomes important in mental health is that if any of you have ever done any had any kind of therapeutic engagements with people, you'll know that if you're just typing text, you miss a lot of the detail of the feeling of being in that room with the person, reading their body language. Even things like pauses become information that we just automatically use to understand that interaction, and that triggers for us a sense of compassion and empathy and understanding. And so for AI to really start to move into that space, we have to give it eyes and ears so that it can see and understand the world, so that we can engage in a more human-like way with these systems. I wanted to touch then on embodiment, which is the other part. That's the agent part of task and action. Embodiment, I've already mentioned in other physical worlds like games, but if you look at how hardware has moved and progressed over the last 60 years. I've even dropped the mainframe off now. I always had a slide on the big room computer. And if any of you are around to even know what that looked like, but let's start with desktops. A lot of the work that I do still is in the space of using mobiles and some of the data that we can collect through our engagement with these devices. So the fact that we turn this phone on and off tells us something about what I'm doing in the day. If I turn the phone on at 4 in the morning, means I'm probably awake at 4 in the morning. There are GPS and other sensors in those phones, which starts to move us into this Internet of Things space, where there are sensors in our environment, which we can learn a lot about our behavior through these sensors, whether that's GPS or proximity or Wi-Fi or screen being turned on and off, or what we're typing in our chat messages. All of these things are enabled by the fact that hardware now lives both in our pockets and has become seamlessly embedded in the environment. And finally, although it may feel like science fiction, I don't think we'll probably by the end of this year have robots that start to move around in our environment with us. There's a large amount of rapid and exciting research being done on taking AIs and putting them into physical bodies. It may not look human like this one, but it might, some of the ones that you will see from like NVIDIA and other of the big players can wheel themselves around. You've probably all seen Boston Dynamics and their little Spot robot, which is a dog that runs around on 4 legs. But I won't go into today, but the field, the transformer architecture has really exploded the pace at which robotics research has been able to be conducted. Partially because, coming back to this idea of embodiment, you could train a system in a 3D world that has the same physics as our world. So you could create like a game world where if you drop a ball, the ball drops. You could then embed a body like this in that world, and you could have that happening in 200 million worlds at once, and all that data being learned. So over the course of a day, you could really have 10 years worth of data if you were just working in our physical world. So again, probably a poor explanation, but hopefully in the question and answers, I can clarify some of my thinking. So that's some of the technology. I think moving towards the idea of AI agents that are able to complete tasks and actions, and the fact that those agents are likely to be embodied in physical bodies in the world are where I see technology and software going. So let's think quickly what those might mean for mental health. Firstly, in terms of prevention, this is a diagram from a piece of work that Dr. Court and I did in Brazil. And it was a chatbot that we used with adolescents on the WhatsApp messaging platform. And what we were able to do is engage with those adolescents in their day-to-day lives and collect information about linguistically from their chats, as well as using some other software about their sleep patterns, etc. And one could imagine that there is a possibility in the future that keeping an eye on people and adolescents through having an AI companion might well be a useful way of understanding and preventing the onset of mental illness. You might imagine a chat buddy in your Telegram or in WhatsApp, or I forget just in this moment in Nepal what's the very popular chat platform is. But yeah, I think the prevention space is a large opportunity. In terms of diagnostics, there is also, this is more in the realm of the work that I currently do, in thinking through passive sensing and how you might collect audio or visual data in a controlled environment and extract information from that audio signal. Maybe in this work by Gary Clifford, extracting heart rate information from the face as the blood comes and flows in and out of the face, but being able to create physiological measures from audio and visual data, and using those physiological measures then as a tool in the diagnostic setting. Thinking a little bit again about how this may be able to improve upon PHQ and some of the other surveys that we have, rather trying to extract information directly from those biomarkers, behavioral biomarkers. In terms of treatment, again, this work actually did come and was run in Nepal, where we were collecting passive data off mobile phones. As I described earlier, we collected GPS, we collected information about steps, we attempted to collect sleep rhythms, when people go to bed and when they get up. It was with a group of postnatally depressed moms, and we also collect data about how much time the mother spends with her infant using a Bluetooth beacon. And so we're able, with the phone and the beacon, to scan for those beacons and see whether the mother and child are together. And this is some early unpublished work, but if we collect all those signals together and look at the group that improved on a PHQ score versus the group that did not, you can see that on some of these scatter plots, going from left to right, there's been an increase in this example here. It's movement or steps. So people have become more active as their depression is lifted. And you can then, your mind can run wild about the options and applications here, that if you see a group of participants that aren't improving, is that an opportunity to triage and have kind of precision medicine where you then go in and target those people in different ways? Does it mean that maybe those people didn't start off with depression and there's something else going on? But there are lots of opportunities within this space as well, I think, for longitudinal monitoring of treatment using passive data and possibly AI as well. Some other ideas, if you think about your setting, I know certainly here in South Africa, it's very difficult to get sufficient and high quality supervision. And we also have lay counselors and other cadre of staff who really rely heavily on supervision on a group of people that are not easily, who are themselves very burdened. So could we support supervision in some way and create a co-pilot for the supervisor that's maybe reviewing transcripts of sessions, giving feedback, et cetera, et cetera. There is also possibilities within the health system itself, I think, to embed some of these technologies to maybe improve how much time trained healthcare workers are spending doing menial tasks versus actually seeing clients and being able to make that difference. And then, as I say, at the moment, I imagine this year we'll start to see the emergence of these companions that are embedded in our chat systems, but I wouldn't be surprised if in 2025 we don't see the beginnings of these companions starting to become embodied in some ways, whether they're cute little fluffy toys or fully fledged autonomous humanoids. So those are some of the things I see coming. Wanted to briefly touch, this is my second last line, I think, briefly touch on some of the risks. And I think in the discussions, we maybe want to go into this a little bit as well. But there are, particularly in this combination of AI and mental health, a lot of ethical considerations. If you are using these models and those very private details about your life are going into a corporate database that owns that data, how do you feel about that if they're training on that, if someone's able to see some of those issues that you're having, etc. There's also a really fascinating issue around liability. So if you as a psychiatrist or psychologist are talking with a client and they say that they are suicidal, you may have a suicide prevention plan or do some steps with that person, but ultimately you then become responsible for getting and seeking that care for that person. If that were an automated therapist, who is responsible? The company that built the chatbot therapist? Is it somebody else? So thinking through who becomes liable is important. There is also the risk of a loss of agency, which means if any of you have ever used Google Maps, you may, if you're like me, trust the map more than yourself. If the map says turn left, turn right, you just follow along. You're no longer agentic and making those decisions for yourself. You're just trusting the system. I learned to my peril about a year ago that's a terrible idea. I've lived in the same city my whole life, and Google Maps wanted me to go this new route. And I was like, there's no road, like that's not a road. Anyways, I thought I must be wrong, but ended up in the middle of a field with no exit, and I was just had to reverse my way out. So how this applies in our setting in mental health, the issue that I see and potentially worry about is that if therapists start to rely on a kind of a co-pilot, do you stop thinking for yourself? If it says something that you disagree with through your training, do you think, well, it knows better than me, I should just listen to it and ask my client X or Y? And so I think talking about agency is important. And then in our LMIC settings, we all know about the issues of bias and explainability. If the data is really from a lot of Western countries, how is the advice, the way that mental health is understood in Nepal, with the heart mind and the head mind, or in South Africa, where we have this kind of ancestral piece, how is that reflected in these models and their ability to respond? So that's briefly a tour there. I'll end with a couple of tools that may be interesting to you. The first is called Perplexity AI. And it's sort of, I've found to be more useful than Google recently, where instead of Googling a result and then having to find your way through all the ads and reading the pages, you just type your question into Perplexity, and it then does that searching for you and produces a small answer. So that's one tool that's quite helpful. If you are more in an academic environment, Elicit is quite a useful tool, as it allows you to summarize a lot of literature very quickly And you're also able to extract things like sample size and whether they were RCTs or what methodology was used. So that's quite useful. And the last one for doing literature sort of scoping is Research Rabbit, where you could put an article in that you found and it will show you how it connects to other research out there. And that allows you to kind of really make sure that you have found everything in that space. So thank you very much. I appreciate you all listening.
Amazing, impressive presentation, yeah. It was such a really refreshing to listen to such a fascinating topic. I think it would be really helpful for us as well. So everyone, if you have any queries to ask or anything, any curiosity to ask to our speaker, feel free to input your queries in the message box or raise your hand using the Zoom app. We'll be having about 10 minutes of Q&A session, and we'll be moving towards the breakout session.
I might jump in with a question if that's okay, Benita?
Yeah, sure. Yeah.
Okay, sure. So Al, one of the things that you mentioned towards the end there, I know we've discussed a lot about, could be really interesting to a lot of the people on the webinar today, is kind of these ideas around supervision and building kind of repositories. Could you talk a little bit more about that process and how maybe especially those involved in counseling or therapy and training and supervision could, begin this process of like building a virtual supervisor?
Absolutely. Happy to talk about that. I wonder if I could give you a task while I do that. Maybe you could find our paper on supervision and pop it in the chat, Brandon, if that would be doable.
Will do.
But just to say, I think that there's this idea of supervision is really exciting and interesting because, I think a lot of us have spent parts of our career working out how to task shift to lay counselors potentially, but there's still this issue of how do you make sure that they're delivering these manualized interventions adequately. And often that means supervision by people who themselves very busy and stretched. And so what the idea that people are starting to think through is, would it be possible to supplement supervision in some way using AI? And in order to do that, you obviously want to have, it's useful to have examples of how supervision currently runs. It's a very private engagement often, right? And so the models that exist are only trained on publicly available data. So they may not have seen a whole lot of supervisory sessions. And so I think one of the things that is a real opportunity for us is to think through how we might be able to be recording those sessions in some ways that would allow for us to fine-tune a model on how supervision sessions run. And I think that what's exciting about, say, thinking of South Africa or Nepal is that that could then be done in a culturally appropriate way. And so if we were all to be collecting these data sets, we might be able to make a version of one of these models that is able to support supervision and provide that supervision, but in a way that is aligned with how we already would like to see it done. So that's one. The other piece around supervision that I think people are excited about is there is work on like these therapeutic moments when there's like a breakthrough, right? That you say something. And so having the transcripts of sessions between a provider and a client, and then training a model on learning and understanding what those moments look like, or missed opportunities, I think are equally important, where there was an opportunity for something to be said, I think is another data set that I think would speed up the process of us trying to build some of these tools. Thank you so much for finding that article, Brandon. If anybody's interested in this idea, you can see a little bit more about it in that piece.
Okay, so we have question from Ritika ma'am. So what are some of the most common misconceptions related to use of AI in research that you have encountered that causes resistance in its uptake, and any ideas to address them?
Thank you for the question. There's a lot of misconception. I think so it's both misconception, but also I think ideas of how we want to think about what's happening with these tools. But one misconception is that they are always accurate. Okay, so that if you just type something in, you'll get something back and you can copy and paste that into whatever you're doing and you're done. They aren't that good yet. There is a funny paper, or there was something I read the other day. If you can, yeah, people just cutting and pasting things from ChatGPT isn't the way to go. So I think that's the first thing I would just say, is that it's a useful, maybe to help you brainstorm, maybe to think of things you haven't thought of yourself, but you then want to still do the work yourself at this point in time of going and validating some of that, finding the right resources, etc. So I think that's one of the most common misconceptions. And the other maybe is on the other side, and that is people who think that they are not yet capable enough to be able to be useful. And I think that's another massive misconception. They already are hugely useful tools. And I think that people think there's still a long ways to go before that we can use them. They hear one or two things about hallucination and they think, okay, I don't have to pay attention. But just for all of us here, this field is moving so quickly that I think 2024 is going to look very different at the end than the beginning. So we all need to keep paying attention. Don't say, I've thought about AI once, I know that whole thing. And because it moves at such a different pace than other fields, you have to really keep revisiting and understanding what's changed.
Thank you so much, Yael, for the clarification. So, okay. And Susmita Panditji have said that adding objectivity to a field whose essence is subjectivity. Yeah, she had compliment for you, Al. So if anyone have any kind of curiosities, you can ask it now, and then after we will move into a breakout session. So Ritika ma'am, I think breakout session would be better for. Yeah, okay.
Sorry. Hi, Al. Yeah, super interesting talk. One of the things I was really thinking about was in terms of when you mentioned about feeding transcript in regards to provider and client to training the machine. So I was just thinking through on what if the transcripts are bad, or let's say, what if the transcript, or what if the session between the provider and the client is what it was not supposed to be. So I was just thinking through, and how do you filter all of those things? And thinking like more than that, what if the data is wrong, right? So for example, if we're looking at, let's take this example of stand strong. If we are looking at the data coming from a mobile phone and the phone was not supposed to be with the person that it was supposed to be. So how do you filter like those kind of things in there? So that was my first question. And another question was all in terms of the biases in AI. So I've read a lot about how AI also has some kind of biases in terms of race and all. So I think that's a reflection of what happens in real world, right? So, and like just thinking from your perspective, like how do you address all of those things?
Thanks for the questions, Suhada. I remember two, so I'll answer two questions, but you might have asked a third. To your first question about what happens if the data is like not that good that you're putting in, I think that is a really important consideration. The field had this mantra, scale is all you need, which basically means that if you just throw enough computers at the problem and enough sort of processing power, you could overcome most things. But that's been now shown to be false. And there are quite a few very well-cited papers showing that you can have way less compute if your data quality is of a higher standard. And so what happened in some of the early models is they just threw all the text they could find in, but some of the text was garbled and was just sort of not that useful. And if they train rather just on like academic textbooks, they need way less computing and way less data to create a better model. So I think that's still an important limitation, is the quality of the data we have. And so if those transcripts aren't great, I think the output is likely at this point not to be great. One interesting thing that's emerging as a way around this problem is the idea of synthetic data. And so that is, you take a large model like GPT-4 and have it synthesize counselor-client interactions, and then you use those transcripts as your training data. And so I think that's, I've heard this idea that we train the first AI using human knowledge, but we're going to train the second AI using the first AI's knowledge. So it might be that we've kind of bootstrapped ourselves to a point now where we can start to generate new data. So that's a little bit of an aside to your first question. And then to the second, I think I must say, I feel like some of these models are better than in terms of bias than they were a couple of years ago. The very first, I mean, Sahado, when you and I did that work in South Africa, I remember with the object detection system we had, we kept finding umbrellas being detected in the photos. And yet when we looked, it was just the shape of the houses here in South Africa. They all have roofs that look a bit like umbrellas. The newer systems, I think people have been paying attention. What I see is that you now have to prompt more for what you want. So like the default might be a Western mindset. If we think about mental health, if you ask what is depression, it'll give you a kind of Western answer. You could get it probably to give you the understanding of mental health in South Africa, but you're going to have to work harder to say in South Africa, in an African context where these beliefs are, what does mental health look like? So I think that's where the bias still exists. But hopefully that answers your two questions.
Thanks, Al.
Yeah. Okay, the last question. Is AI-related research feasible in Nepal? What do you think?
Yes, it is, because we're doing it already. So we can answer that question in the positive. The challenges are the same as we saw with mHealth, and that is that the infrastructure is often, it's more expensive sometimes for data. It might be that devices are harder to charge and there's no electricity. So it's those sorts of things that still, I think, LMIC settings like the one you and I live in are a problem, but it's definitely feasible. So yes, it's an exciting time to be in the space.
Yeah. Okay, we have a question as well. So shall we take it, or we have to move it to the breakout sessions? What do you think, Ritika ma'am?
Apologies, team. We will have to move to the breakout session now because we have less than 15 minutes left. But all the people who are asking the questions are actually in the breakout room with Al. So perhaps you can sort of use a little bit of time to dwell on these questions as well, which very much corresponds with your the discussion questions that you have put forth, Al. So I think we are safe to move to the breakout rooms. Team, I've tried to make people, I've tried to group it in such a way that people who definitely speak English are with Al, because Al will not be able to speak Nepali. So please bear with us. And the rest of the people are divided in the other groups. Each breakout room will have 9 minutes, after which you will be pushed back to the main room. The final 5 minutes of our webinar, we will quickly summarize the discussions of our breakout rooms, and Al will have a couple of inputs of his own on the discussion questions, and then we'll bid us goodbye for now. So I'm opening the breakout rooms now. Please use the chat feature if anybody faces any problems. Enjoy your discussions. Ram Kumarji, Monita ji, any problem?
Okay. So shall I? Yeah, okay.
Please go ahead with that.
Yeah, we were discussing on the second questions related to the future of human AI collaboration in mental health. So, in the beginning, we were really in dilemma like how to discuss in the topic. So many of us were new. So in these questions, all of us has agreed that the AI can aid in, but it cannot replace the human involvement or human professionals from the mental health care. So basically, we discuss that the AI can support several aspects of care, mental health care. However, it human professional also fulfill the need in therapeutic process as well, like if it can AI can make the mental health care accessible to many places through the remote monitoring or any kind of technology. However, when it comes to the interventions and collaborative care, so human therapists and clinicians can do it better, but through the prioritization of well-being, dignity, and the consideration of ethical principles that exist in between the in between the community, the social context, and personal values as well. So we were discussing in between the need of how the technologies rely the need of child or adolescent in mental health. So yeah, I'm also new in this topic, so I find it difficult to incorporate all the findings. So you can explain it. So your turn, Ritika ma'am.
Thank you, Vintaji. Sounds like you guys had a really good discussion. I'll keep it very brief. Our group is in complete agreement with your group. Our group does not feel that AI can at any time replace humans, but we had a more constructive discussion on how the collaboration can go hand in hand. And some of our participants mentioned that they actually have used AI. For example, they will not replace counselors, but AI can be very helpful in a search generation of information and helpline, like helpline numbers that is specific to a particular country. It can help in building databases, for example. We also discussed how our participants have used AI in planning and building programs, developing sort of helping them develop curriculums for trainings, but it will not replace the trainer, but it can always help in building trainings, for example. Um, our One of our participants also mentioned a website, poe.com, that is also a very local version of ChatGPT, according to him. I would encourage people to explore it. But there was also this underlying understanding that we will need to address misconceptions and bring people together in the usage of AI so that humans and artificial intelligence can go hand in hand and not seem confrontational. Over to you, Al.
Thanks. It sounds like two really great discussions, and just in the minute that I have, we'll wrap up. I think our group agreed. There were also questions about what was the role and where it fitted in, and I think that in general questions, there's so many questions we had around data safety, around what is the role, should it be supplementary? So maybe just as a way of wrapping up, I think it's great that these discussions have started, and I encourage all of us to keep having the discussions. There's a lot that's changing, and so I think that we probably need to decide ourselves what we want AI's role to be, and not just leave it to chance. So if we want it to be a tool that we use and that we want to continue, we should make that the approach that we take. Maybe, one other concept, maybe just to share in the last 30 seconds, is this idea of the Overton window. So basically, the Overton window is a kind of agreement about what is socially acceptable to talk about within the realm of where society is currently. And that changes all the time. What you can talk about today, maybe our parents or our grandparents couldn't. And there are things like artificial general intelligence, this idea of embodiment and robotics, which are outside of the current acceptable window. And so I think exploring those ideas of what does it mean for us if we develop something as smart as ourselves, are good questions to have and conversations to have, because we want to frame the future and not just let the future happen to us. So thank you very much for your time and for this opportunity.
Thank you so much, Al, for bringing this topic to our webinar. I think it was absolutely necessary for us. So, for our early career researchers like us, like we were totally unaware about the depth that we are discussing here in the discussion question, and it was really helpful with this presentation as well for the future as well. So, I would acknowledge everyone for their participations, and thank you so much, Brandon. Thank you so much, Ritika ma'am, and thank you so much, everyone, for your participation. And we will share the webinar materials to you. So please do register the webinar if you haven't still. And please also fill out the feedback form as well. Thank you so much, and see you in the next webinar. Bye-bye.
Thank you.
Thank you so
Bye.
much. Thank you. Thank you.